Hello everyone, this is Dr. Jayanti Ravindran and this video is to address how someone can get a fairer skin instantly. So this is the question that's asked and so I'm trying to address. I am not advocating that fair skin is the best and everyone should have fair skin. I understand that what you're trying to convey is maybe you had a fair complexion and the skin got tan over a period of time and you want to reverse it back and you want to know how it's done quickly. Now you must understand that we are trying to remove the tan. Actually a nice fair complexion, someone who has a nice fair complexion and they have a clear skin and they developed pigmentation because they did not take care of the skin. That's the basic truth. Basically you did not apply good moisturizer, sunscreen, and that's why you have tan. Now after this procedure doesn't mean for the rest of your life the skin is going to remain as fair and as glowing as you have got the results. So it is very, very important that you take all the precautions and the treatment protocol that I advise to you to maintain this the clear complexion that you have got after the procedure. So we use a peel called Melanin peel, and I'm naming the peel because I feel that's the best option. In my experience, for Asian skin, especially for South Indian skin, give a good result in 3 weeks. I find this as the best option. So when the peel is applied like a mask, we test the reaction that is done in the clinic. And then once we assess the thickness of the skin and how long we can leave the mask, then we give you the guidance accordingly, and then we let you go home and then wash the face after about 6 hours, 8 hours, 10 hours, depend on the condition, what we're trying to correct, how deep is the pigmentation and your oily skin or whether it's a dry skin, and based on all these factors. After you cleanse the skin for the next following 2 days, we advise you to use some moisturizer, and then we start with the home care treatment program which goes on continuously. It is not only this peels, there are a lot of lasers which can remove pigmentation from the skin. But in my experience, when lasers are used aggressively in quite a significant number of patients in South Indian skin, they tend to retan or they tend to get PIH, post-inflammatory hyperpigmentation. We have other medium depth or superficial peels, and they are done maybe for 4 sessions or 6 sessions. Yes, it is done when someone wants a fair complexion but also have acne, and there are some specific indication for them and they are also advised, but I would say their results are less compared to controlled depth peel. We can also give you cream programs to reduce the tan, but you must understand that's going to take some time, maybe 6 weeks, 8 weeks to remove the tan gradually. And in that process, we also add some superficial or deep, medium depth peel. I do not recommend deep peels like trichloroacetic acid peels in South Indian Asian skin on a regular basis, because rarely you get PIH and it's very difficult to remove them. Superficial and medium depth, if you keep repeating every now and then you're gradually peeling off your epidermis, and if you're not going to rebuild your skin, the skin starts to form a lot of wrinkles, and the appearance of aging starts very soon. There are a lot of options available. You have controlled depth peel, you have superficial medium depth peel, you have cream programs, and you also have lasers. But it's good that you consult a cosmetologist or a plastic surgeon specializing in aesthetic work, so they understand both the in-depth anatomy as well as what suits for your skin, and then basically you can follow any one of these procedures. Thank you.